It's an honor for me to be here and to be part of your annual conference. Thanks for invitation, for creating the space to share our challenges, our ideas, and for this opportunity for our future networking and connections as well. So my name is Dr. Rusudan Gvamichava. To be honest, this is my first time presenting as a doctor because I just finalized my PhD at University of Westminster in London, and it's honor as well. And today I'm very proud to present our project from Georgia and about the topic like nutritional support during the cancer treatment and what kind of project we had in Georgia, what we did, and what kind of challenges we have nowadays, I think, around the world and especially in Georgia. So during my presentation, I would like to underline the importance of nutrition as a nutritional support therapy during the cancer treatment, as well talk about cachexia and the factors, about the diet during the cancer treatment, because this is a very challenging topic during the side effects, how to manage their proper diet, patients' proper diet during the cancer treatment, manage their side effects, as well as I mentioned our project in Georgia, why we decided and how we decided to create a guide for cancer patients and their family members as well. And finally about diets during the chemotherapy and radiation, different kind of therapies. So first of all, I would like to underline that nutrition is a silent partner of the cancer treatment. While oncologists focus on the cancer treatment, the nutrition and surgery and chemotherapy or radiation therapy, nutrition remains under emphasis, and it's essential topic to support the health, to support the whole body, and first of all, to maintain the quality of life of patients and their family members. So it's not only important for cancer treatment, it's important for recovery, and of course, as Professor Ferrari mentioned, it's big part of the prevention. So, and food is one of the few things, unfortunately, I would say, what can be controlled by nutritionists and doctors during the cancer treatment. But what we saw in Georgia, there is a big gap, particularly in nutrition support, because this is not a regular thing for cancer patients in Georgia to have a consultation with a nutritionist or someone like this. And many patients, they kind of left to navigate their dietary requirements and intakes and decide by themselves or by their family members what to eat, how to eat, and what will be better for that time for their health. And also what is super dangerous nowadays, I would say, they often use some kind of not science-based online resources like social media, for example, Facebook or Instagram or ChatGPT nowadays, which is not absolutely personalized, and this is a very general information, and sometimes it's absolutely not true. Cachexia, let me talk about cachexia a few words. So this affects up to 80% of the cancer patients, especially in Georgia, about advanced cancer patients, I would say. And this is not just a weight loss, it's loss of muscle tissues and fats at the same time, which leads to weakness and poor health outcomes, and of course the poor treatment outcomes, which makes much difficult the whole treatment and support process. So in Georgia, cachexia is often unrecognized, unfortunately, and it's really managed on early stages, which makes it more difficult. So sometimes even the cancer treatment is stopped because of this reason. And I would say that cachexia is a result of like the metabolic demands of the cancer and also the side effects of the treatment. So as we know, it's part of different side effects like early satiety, taste or smell changes, loss of appetite, for example, anorexia and weight loss, and sarcopenia also. So as you can see, this is like a whole combined factors which affect altogether, unfortunately, during the cancer treatment period. I would say that diet, why we decided to talk more and focus more about like diet during the treatment. Diet becomes as a form of support therapy for cancer patients and for their family members, and a well-structured and personalized eating plan during the cancer treatment can be a huge support to improve quality of life as well, not only treatment. So it improves like energy, strength, like it also preserves muscle mass. But first of all, to focus on like side effects, what we have. This is a very personal, what the patients might have, but many of them are like constipations from medications and some kind of therapy, diarrhea, especially from radiation, some extreme fatigue, nausea and vomiting, which makes even more difficult to eat and less taste and appetite. And of course, all this reduce like appetite, disrupts the digestive system and makes it more difficult to just eat, not even like to just eat healthy. In Georgia, as I mentioned, the nutritional counseling is not part of the treatment, unfortunately, yet. So many patients, they simply just stop eating properly, sometimes even unintentionally. So why diet then is so important during this period? First of all, to help to manage the side effects and improve energy and strength when the patients are not feeling their best during that period of their life, to preserve muscle mass, to kind of preserve immune function as well, because this is crucial to support immune system as we can during this period, and of course to reduce inflammation, because as well Professor Ferrari mentioned earlier, inflammation is a very big supporter for cancer, unfortunately. And of course to improve the quality of life and how the patient feels physically and mentally at the same time. And also in Georgia, patients, they very often and their family members ask like how we can support our family member, what should we cook, what food should be avoided. Before 2024, there was no special material in Georgian language or something like this to support their question. What diet should look like during the cancer treatment? So I would say that we need a balanced diet, of course, it should be kind of personalized according to what kind of cancer there is, and what kind of treatment is used, like it's surgery or any kind of therapy. But we need all like macronutrients, like we need protein, like lean meat or egg or legumes, which are super rich in fiber and it can support the digestion as well. We need like healthy fats like nuts or olive oil or something like this for satiety. We need complex carbs for a steady energy to kind of stay productive and feel their best for the cancer patients, and of course like plenty vitamins or minerals from vegetables, like complex carbs and fruits, for example. So, but the question often was how we can like use this kind of very generic like advices, I would say recommendations, according to Georgian traditional food and traditional recipes which might be found easily in the market or shop, and it's kind of affordable. So that was our question, like why was it needed, and they needed a very simple like ideas how to eat, especially for example, breakfast, lunch, and dinner. Very simple meal plan, how to manage their meals during the day. So there was like no structured guideline or any kind of like handbook in Georgian language. It was lots of like, and there is still lots of unregulated recommendations in social media. And like online advices, and there is like big lack of awareness as a like public health field, I would say, about nutrition, how important it might be during the cancer treatment. So this all like left caregivers and patients the anxious and confused feeling that they had like no power to somehow support their family member. So that's why we decided to, as I mentioned, there was like lack of resources in Georgia, and language barrier is huge because in Georgian our national language is only Georgian. So we had no kind of Georgian language material to support it. You know, we can't say that all Georgians speak English, so it was a big gap and barrier, and of course unreliable information with super unregulated content like online. So we had lots of like different guidelines like this. This is just example, amazing, super functional information like guide from Stanford Medicine and Stanford University, but this is in English, and this is all adapted to different countries because some of the examples of the food, for example, like papaya or some tropical fruits, are absolutely not related to Georgia, and this sometimes is super confusing for people to understand how they can kind of swap a little bit this kind of example and adopt to Georgia. So this is amazing table, but what we decided, our project was, thanks to Embassy of Slovakia, we had a grant and we created a first like a handbook for Georgian population, how to eat during the cancer treatment for radiation therapy especially, according to side effects. So how to minimize them and how to support it with traditional affordable food and recipes. And what was the most important, that this is absolutely free, and this is a free online resource available on Georgian Society of Clinical Oncology. So we have a printed version in different kind of hospitals, but we have online version on this link as well. So what was included in this handbook? So lots of information like about micronutrients and micronutrients, and reliable information about like essential nutrients, so what they need to know about fats, protein, carbs, and vitamins and minerals as well, because there's lots of confusion that you need some like supplement and it's a must and everyone should get it, but because as I mentioned, it's not kind of regulated in social media as well. The guidance on meal distribution and planning, so we had a very simple recommendations, for example, how to have like 3 simple meals with traditional affordable food, Georgian food, and also to kind of have some little snack which just takes like 10-15 minutes max. So it was super easy to follow recipes at the end as well. We have like 2 days meal plan option, like for whole days. Of course, it was everything like local and budget friendly. We even had like some seasonal like recipes which can be used, for example, for summer and for winter to be more affordable according to local time. And also some practical daily nutrition tips, so how they can improve their habits, especially during the cancer treatment. So all this made much easier for cancer patients and their family members to assess the science-based reliable information, which is like simplified nutrition with a very simple like information boxes, and getting all to support to get all the essential daily nutrients. And of course, all this was to improve their treatment and recovery chances, at the same time to minimize the side effects, and of course to improve their quality of life. So, for example, what was their like this little simple information looks like? So, how can diet help manage cancer treatment during the side effects? For example, we have mentioned 5 main side effects. For example, the appetite loss, constipation, diarrhea, and I will show you another slide. And we had some very short ideas. We have just these few slides to give you the flavor, what we included. So for example, to eat small meals, and we even included like in the grams how small meals should look like. Some nutritious snacks, because sometimes it's much easier for cancer patients to eat just very like little, I would say, snack instead of like a huge meal. Also, constipation could be a very huge challenge for some cancer patients, and to increase their fluid intake with water or maybe some juices as well if they have like a bad taste or something and they can't eat like drink lots of water, to include fiber-rich food or fiber supplement if it's needed, or like foods, for example, veggies and beans if it's appropriate for their case. And about diarrhea, to like choose foods and drinks like with sodium and potassium, to include as well like electrolytes in their meals and drinks. So other like side effects also included loss of taste. For example, to try new flavors and new foods. It is a very famous like practice how to kind of increase the taste a little bit, to use some kind of spices and strong flavors, which helps during that time. And for example, for side effects like nausea, there is some anti-nausea foods like citrus, ginger, or peppermint oil or peppermint tea as well, to kind of support the digestion for this time. As well, about the chemotherapy, we had some like ideas how to plan the day of chemotherapy and what to include. For example, to have some little snack in their bag when they are just waiting like for their treatment, even to have like some little juices or lollipops, because something cool is very comfortable for them, or include some fruits which are more like simple and carb based, like bananas. Also like to include some light and bland food if they have some issue with digestion, for example, like some light yogurts or cottage cheese, because for example we had lots of dairy products here because in Georgia people love it and it's really affordable and it's very comfortable for them to include those. So as well, we have like different options. We have some meat option as well, like chicken rice soup or something like this, to be like more modified by the person and choose what they like more for that time. As well, to like eat small meals and snacks like lower fat and like cool food, especially for like hot days, and to drink lots of fluids frequently. So about the restriction, there was lots of question what should be in a like red list, I would say, and say absolute like 100% no to those food. I would say it's like raw or light liquid food, especially like meat and egg and fish as well, because we know like there is some chances of toxicity, so we are trying to avoid it, especially as well unpasteurized dairy products, which might be super dangerous, especially during the summer and hot season, and of course the unwashed fruits and vegetables, because we are trying our best during this time to support the immune system and avoid any kind of chance of those kind of food in the diet. Then we decided, after creating the handbook, to have some presentation, and we had some trainings for healthcare professionals in other cities as well, like Batumi, because to train healthcare professionals and to include in their recommendations as well some very simple tips even about the nutrition might be very big progress for next years, and sharing like reliable up-to-date knowledge with practical tailored to Georgian foods examples, and this all works to preventive medicine, like before diagnosis for example, but after the diagnosis we need to support the cancer treatment via food and diet as well. So, and of course this all affects and helps to improve the patient's outcome of the treatment. So, and also after that we even had some collaboration with like corporate collaborations with different companies, very famous in Georgia, for example, some pharmacy companies as well, because they wanted to kind of support their employees as well if they had anyone with cancer, as a cancer patients, to support as a family member, and also to educate their employers how important it is to eat healthy, to prevent some kind of challenges and health issues later in life, especially related to cancer, but also if it happens we can support it during the cancer treatment, and it really supported lots of, I would say, thousands of families in Georgia, and now we are trying to kind of add some new handbooks for more like different advanced version. So thank you very much for your time for this topic, because I know cancer, nutrition related to cancer is a little bit more, I would say, new topic, and I'm more than happy to be here, part of this annual conference, and I hope that nutrition and cancer topic will be discussed in different conferences in the future as well. And if you have, of course, the question, I'm more than happy to answer that.